All right, today we're diving into something called primary biliary cholangitis, or PBC for short. It's a chronic liver condition that's a bit of a medical detective story, because it can be really tricky to spot, often hiding in plain sight until some very specific clues start to pop up.
So what are we actually talking about here? Well, at its very core, PBC is an autoimmune condition. Now, the easiest way to think about this is to imagine your immune system as your body's personal security team. But with PBC, that security team makes a big mistake. It misidentifies a part of you, specifically the tiny bile ducts inside your liver, as a threat, and it starts to attack them. Over time, this attack causes inflammation and damage.
And this is where it gets really interesting. One of the most striking things about PBC is who it affects. Look at this ratio, 9-to-1. The condition is overwhelmingly found in women. For every single man who gets diagnosed, 9 women do. This fact, especially when we're talking about middle-aged women, becomes a massive clue for doctors trying to piece this puzzle together. So in this explainer, we're going to walk through the typical journey of understanding PBC. First, we'll look at those first telltale signs. Then we'll get into how a diagnosis is actually confirmed. After that, we'll cover how the condition is managed day to day, and finally, we'll talk about the long-term outlook. Okay, let's start right at the beginning. How would someone even begin to suspect they might have PBC? What are those first clues that something is off?
This quote from the source material really just nails it. The classic textbook presentation often starts right here. We're talking about a persistent, widespread itch that doctors call pruritus. And this isn't just a minor annoyance, it can be intense, and it's very often the first real symptom that makes someone say, okay, I need to see a doctor.
You know, the condition can really change over time. Early on, someone might feel this deep, profound fatigue, or that relentless itching we just mentioned. And sometimes there are no symptoms at all, it's just found by chance on a routine blood test. But as the condition progresses, more obvious signs can start to show up. Things like jaundice, which is a yellowing of the skin and eyes, or maybe hyperpigmentation, a darkening of the skin. You might even see these little fatty deposits on the skin called xanthelasmas, especially around the eyelids. And in some cases, you get what's called hepatosplenomegaly, and that's just the medical term for the swelling and enlargement of both the liver and the spleen.
Now, because PBC is an autoimmune issue, it often doesn't travel alone. It's frequently found hanging out with other conditions where the immune system is also a bit overactive. The link with Sjogren's syndrome is incredibly strong, affecting up to 80% of patients. I mean, that's a huge overlap.
So, you've got these initial symptoms, this growing suspicion of PBC. How do doctors go from that suspicion to being absolutely certain about a diagnosis?
Thankfully, the diagnostic path is actually pretty straightforward. It really boils down to 2 main steps. First, they'll run blood tests to look for very specific antibodies that are the hallmarks of this disease. And second, they'll use imaging, like an ultrasound, just to be sure there isn't some kind of physical blockage in the bile ducts that could be mimicking the symptoms.
The absolute key to that blood test is a marker called the anti-mitochondrial antibody, or AMA. And get this, it shows up in 98% of people with PBC. That's not just common, it's incredibly specific. It means if that antibody is in your blood, it is an extremely strong sign that you have the condition. It gives doctors a really high degree of certainty.
And while that AMA test is the superstar of the show, doctors also look for some supporting evidence in the blood work. Think of these as the supporting cast. About 30% of patients will also have something called smooth muscle antibodies, and many will have elevated levels of another antibody known as IgM. Altogether, these tests paint a very, very clear diagnostic picture.
Okay, so once the diagnosis is confirmed, the focus shifts completely. The question is no longer, what is this? It becomes, so what are we going to do about it? This brings us to the active, day-to-day management of PBC. The cornerstone of treatment, the absolute go-to, first-line therapy for almost everyone diagnosed with PBC is a medication called ursodeoxycholic acid.
So, what does this medication actually do? Well, its main job is to help protect the liver cells from the toxic effects of all that bile that's building up. And by doing that, it accomplishes 2 huge things. It slows down the progression of the disease itself, and it helps improve the patient's symptoms. It's an absolutely crucial part of long-term management.
But of course, managing a chronic condition is never just about one medication. It's also about quality of life. For that really intense itching, that pruritus, there's another medication called cholesterimin that can help. And on the other side, because PBC messes with bile flow, which you need to absorb certain vitamins, patients often need to take supplements for fat-soluble vitamins like A, D, E, and K.
Now, for patients whose liver has taken on a lot of damage over the years and is starting to head towards failure, there is another major and often life-saving treatment option on the table: liver transplantation. In fact, PBC is one of the leading reasons why people receive liver transplants.
And that brings us to our final section, the long-term outlook. What does living with PBC really look like over the course of years and decades?
Well, that constant long-term inflammation can eventually lead to permanent scarring of the liver tissue. That condition is called cirrhosis. That scarring, in turn, can cause a whole cascade of other problems, like dangerously high blood pressure in the veins that feed the liver. That's called portal hypertension. There's also a known link to bone-thinning conditions like osteoporosis, which is why keeping an eye on bone health is so important.
Okay, this next point is a sobering one, but it is absolutely critical to understand. The chronic inflammation from PBC significantly raises the risk of developing a specific kind of liver cancer called hepatocellular carcinoma. The risk is 20 times higher than it is for the general population. This is precisely why regular monitoring and cancer screening are an essential part of the long-term plan for anyone living with PBC.
So we've followed this whole journey from that very first symptom all the way to diagnosis and long-term management. PBC is such a clear example of our own immune system getting its wires crossed, and it leaves us with this final thought. As our understanding of the immune system gets deeper and more sophisticated, what might the future hold? As we unravel these mysteries, what new, more targeted therapies could be waiting just around the corner? The future of treating diseases like this is probably hidden in the secrets we're still uncovering inside our own bodies.